So the first thing we are going to do now is to write the title. Nursing care plan of Mrs. O.C. with malnutrition. So the first thing we are going to draw now is the serial number. You drag it down. The next one, the nursing diagnosis. Nursing diagnosis. The second one, nursing objective. Nursing objective. You drag it down. Nursing action or nursing intervention. Nursing action. You drag it. Scientific rationale. You drag it. That's my scientific rationale is too small. The nursing action and scientific rationale supposed to be bigger than every other one. Okay. Now write evaluation. Evaluation. This one is now signature. Signature. Less. Next nursing diagnosis, imbalance nutrition less than body requirements. Related to reduced dietary intake. Evidence by weight loss. So our nursing objective is now Mrs. O.C. will gain 5 kg weight, have enhanced energy level and normalize albumin level within 2 weeks of nursing intervention. So our nursing action now is assess dietary intake and identify barrier to adequate nutrition. Our rationale for it is that understanding eating pattern helps in developing individualized nutrition plan. The second one now is monitor weight, BMI, lab values which is the serum albumin. This second action now, the rationale for it is regular monitoring tracks progress and adjust intervention as needed. So our third action now is collaborate with a dietitian to provide a high protein and a high calorie diet tailored to our need. Proper dietary planning ensures optimal nutrient intake for recovery. So the next one is encourage small frequent meal and supplement as tolerated. This smaller portion now can be easy. It will be easier to tolerate, increasing overall intake. So the fifth one is educate her on cost effective nutrients to overcome financial barrier. She's having this malnutrition because she is having financial constraints. So you teach her that instead of using chicken, meat, you can also use crayfish. You can buy periwinkle. You can plant greening vegetable at your backyard. Cost effective nutrient to overcome financial barrier. So this thing will now help her make better food choice within budget constraint, within our budget. So the next one is address any underlying condition affecting nutrient absorption, diabetes mellitus. If you check the question, you know that this woman has type 2 diabetes mellitus And in this diabetes mellitus, what it does is that there is glucose. There is enough glucose in the body, but there is insulin resistance. Let me just use a light scenario now. Like, insulin is the boss. Why the glucose in the body now is passenger. The body system is the pack. Insulin is the boss that will take you to your destination. Why the glucose now are people, are passengers that are traveling. So in the case of diabetes mellitus now, there is glucose, there's enough glucose. That's it, there's hyperglycemia. There is enough passenger in the pack. But because the bus is faulty or there is no fuel in the bus, it cannot move. It cannot take them to their destination. So that is what happened. Even though there is glucose, there is no insulin to transport them to where they are going to be needed, where they are going to be used. So you have to address the underlying condition affecting nutrient absorption. The rationale is managing comorbidity ensures better nutrient absorption and utilization. So our evaluation now is Mrs. OC gained 5 kg weight, has enhanced energy level, normal albumin level within 2 weeks of nursing intervention. So our patient is okay. Our patient needs was met. There is no need for readjustment. So you will now sign. That is everything about nursing care plan. Thank you for watching this video. See you in my next video. Bye.